There'll always be help available, they said. There'll always be someone to ask. Except when they're all in theatre.
For Lee Chambers at Mount Druitt Hospital, day one hasn't gone smoothly.
What's the problem?
I have a guy who's an IV drug abuser who has absolutely no veins, and every time a line goes in, it gets stuffed up within the next 2 hours, and they want me to do something different, and I have no idea what something different entails. So I need to contact someone about that. It wasn't just around. After the round, the nursing staff grab you and say, do this, do this, do this, and while you're there, you do it. And eventually you get back 2 hours later to what you were trying to do in the first place. And I think I'm going to be here later than 7 tonight.
God, in a week's a long time in politics. What's 8 weeks like in casualty?
I think it's a change of personality. I think the young interns that came to us now already, I think, have matured a lot. Their outlook has probably become more cynical and hardened. It's a really bad time in general, but what's really rewarding is that to see these young doctors mature and become more competent and more confident, so they're happier within themselves with the work they're doing.
It had been a long day, and I think it was probably after another long shift, and there'd been a man who had come in with problems with his lungs, and he'd had lung cancer in the past, and it was pretty obvious that this was sort of one of the final stages. When I was taking some blood from him, he just looked at me and said, "This is it, isn't it?" And I just, didn't know what to say, and it just stayed with me all day, and then when I went home I just cried a lot.
Are you tired?
I am today, because I worked 16 hours yesterday. I'm coping.
Are over. Each of the interns is left with mixed feelings. They said it wouldn't be easy. Sue Adams has decided she'd like to do surgery, and she's sure that won't be easy.
On my first night in surgery, when I was on the midnight intern, 3 o'clock in the morning, and the surgeon said to me, "Well, what would you like to do?" And I said, "I'd like to be a surgeon." He said, "Oh, surgery is nice for a woman." And I was only on my second shift or something, so I didn't say anything. But I have to sort out why I want to be a surgeon and make sure that other people saying you can't be a surgeon, you're a woman, makes me want to be a surgeon more.
Basically, after 12 weeks, my fiancée and I parted company, basically. I suppose one of the responses I had to losing a very important part of my life, namely my fiancée, or what I thought would grow to be a marriage and a family life, meant that I decided that I'd have to concentrate at what are now more positive areas, which are my career. And so I've decided to go headlong into becoming a surgeon.
For Hiente Tran, the first term was hard, but much as expected.
What's been the worst part about the last 12 weeks?
The hours and the pressure, especially working in the casualty area. I haven't changed my mind about medicine yet. I still like it.
As a father, would it be fair to say that you're very proud?
Of course, but I never say that. That's in my heart.
And for Lee Chambers, if it wasn't for her church and the support of her family, she doubts that she would have coped.
There's so many conflicts within medicine. On the one hand, you're ready to give yourself to people, and I think that's what a lot of us are doing. We give our time, we give all our efforts, all our energies to our patients, yet we're not in a position to do and to achieve what we want to do. The thing that really annoyed me at Mount Druitt Hospital was that we were so understaffed. On some days, I was left in charge of near 100 patients, post-surgical patients, who needed care and others who just were sitting around getting better. But while the others were in theatre, it was me. Here was me with my 5 weeks experience as an intern and 5 years training behind me, and I was left in charge of these sick people. And that's a very scary situation for one, but I feel it's inappropriate in that they're not getting the care that they need because we're just so overburdened with the amount of work that we had to do.
You going to win?
I'm going to win. It's going to be hard, but I'm going to win.
Dr. John Darcy with that fine report, and our thanks to the doctors who cooperated and to the hospitals, and good luck to those young interns. I'll talk to Malcolm Fraser after this.